My name's Tracy, I'm from London and I'm here today to have a repair to my rotator cuff. I hurt myself when I was on holiday. It was incredibly painful for around 2 weeks. I couldn't really use my arm very much, had to have some physio. So couldn't drive, couldn't do anything.
I'm Nick Ferran, I'm a shoulder and elbow surgeon and I work at BMI the Clementine Churchill Hospital. And I have a passion and interest for doing wide awake shoulder and elbow surgery on my patients. Tracy presented with pain in her shoulder following an injury. The scan suggested she'd torn a tendon in her shoulder, so I recommended that we do keyhole surgery to try to repair that tendon.
I'm having the surgery awake. It's a mixed blessing for me. I'm terrified of general anaesthetics, so having it awake means I don't have that fear. However, I'm not sure how I feel about having someone rustling around in my shoulder while I'm awake, but I will try and watch it. I'm a bit squeamish. I don't know until I'm in there.
With wide awake surgery, the anaesthetist uses an ultrasound probe, very similar to the probe that they would use during pregnancy or other scans about the body, to look at the nerves around the neck, and they put local anaesthetic close to the nerve so it shuts the nerve off for a period of time. That allows the arm to be relaxed, but also prevents the patient from feeling pain during the procedure and for up to 24 hours afterwards.
I know I'm looking at sort of some fairly restricted movement for up to 6 weeks. My arm's going to be strapped up and then some heavy duty physio, but long term the hope is that I'll have full movement and the pain will go away.
Today we went in to do a keyhole operation arthroscopy to look inside the joint, confirm the damage and repair the torn tendon. What was quite interesting, however, was that we looked in and despite the scan suggesting a tendon was torn, we found that the tendon was indeed intact, and therefore we did more of a tidy up operation which was less invasive for her and will mean a much faster recovery. Wide awake shoulder and elbow surgery is not suitable for every patient, for every procedure or for every surgeon. But I'm passionate about delivering this for my patients where possible because it offers them lots of benefits. And I'm lucky enough to have an anaesthetic and theatre team that are able to take a patient through that journey, keeping them confident and comfortable throughout.
Yeah, I'm feeling remarkably good. Very relaxed. No pain. So yes, relieved it's over, but it certainly wasn't an unpleasant or painful experience.
In terms of the benefits for patients, I think as we saw in this case, patients get a massive insight into what is found inside their shoulder and what operation has actually been performed. And this helps them understand their injury or their diagnosis, but also gives them an understanding of the rationale of how we rehabilitate them afterwards and gives them confidence to follow their physiotherapy, either to be cautious when needed or to be aggressive and confident when needed to get their shoulder back to the best after surgery. Because we've done a less invasive operation for Tracy today, I would hope that she'd be back to driving, back to work, which are things that are important to her, and back to her recreational activities as soon as possible, probably back to normal within about 3 months.